This is KTBS 3 First News.
And at 6:48, a revolutionary new breast implant, but is it safe? Welcome back, everyone. Our time is 6:49. It's the most often performed cosmetic surgery, whether for cancer survivors looking to restore their appearance or a boost of self-confidence. Last year, more than 300,000 women had a breast augmentation. A new type of breast implant uses a woman's own tissue, but controversy continues on whether it's safe. Here's Lexi McGee with more.
Commercial airline pilot Mary Saffet navigates the skies without fear.
I flew in the Navy for 7 years.
But nothing could prepare her for a diagnosis of breast cancer. Once in her 20s, another 9 years ago. She underwent surgery both times.
You don't really even mourn that loss of your until after the procedure is done.
Mary got implants after her first lumpectomy to replace what she had lost.
And they don't explain to you really that, hey, we're going to put this implant in, but you really need to get it done again, even if you aren't having any complications whatsoever.
This time she's turning to Dr. Roger Basson for an implant-free breast reconstruction. It starts with lipo from another area of the body, like the stomach.
This is the device where we're able to pull the fat out. Now that we have these beautiful intact fat cells, we're able to take these fat cells and transplant them to other parts of the body.
The removed fat is re-injected into the breasts.
It just feels a little different. I wouldn't call it painful.
We know that by taking the fat cells out intact, we also have stem cells that are intact in there as well, and these stem cells will also aid in growing the new blood vessels to the fat cells that we've transplanted. And there also is some hypothetical theories that suggest that these stem cells will also turn into more breast tissue as well.
Rachel Nye is hoping it's the difference she's been waiting for.
I've seen people play the games of like, oh, are those real or are those not real? You know, and just something I want to keep very natural.
A boost from her own body. I'm Lexi McGee reporting.
The American Society of Plastic Surgeons placed a ban on this type of procedure over concerns that dead fat cells could interfere with mammograms. But it was lifted last year. This procedure costs about $2,000.